to express what I'm feeling when I see you. You flash a smile, I'm like, is this happening? I look your way and then of course drop everything. You walk over and ask if I'm alright. Hey, whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something just feels right. Not everything is energy locked up. It's ready to scream and shout. I won't make a pretend it's quiet. Ready to shake up and break the ice. Maybe a joke first, maybe a pickup line, but either one of those is just a waste of time. I need a better way, I need some inspiration, something that better explains all my motivation. To meet you, know you, and be on your mind. I have to, but how do I put this right? Don't overcomplicate, just say hi or whatever it takes to break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something just feels right. Not everything is energy locked up. It's ready to scream and shout. I won't make the same mistake twice. Ready to shake up and break the ice. Do you have a roadmap that I can try? 'Cause I think I just got lost in your eyes. I have to tell you, I really want to. Whenever I look in your eyes, I won't make the same mistake twice. Ready to shake up and break the ice. Don't walk away, there's more to say. I just need the courage to let you know what's on my mind. Like every time you pass by, something just feels right. Not everything is energy locked up. It's ready to scream and shout. I won't make the same mistake twice. Ready to shake up and break the ice.
So, hi, very good evening. First of all, happy birthday to Anu and Richa Acharya. It's a birthday girls today. So, may you dream big and fulfill all your dreams, and all the best to you. So, today we shall have this MCQ discussion. I've shared few MCQs, text-based as well as image-based questions in Google Group, right? So you can download that, download the PDF from the Google Group, and we are having discussion from those MCQs today. So assuming that you have gone through those MCQs, we shall start off our discussion, right? So before that, a very good evening all of you. Hope you're all fearless. And hi Bernice, Srish, Shivaranjani, Niharika, Deepthi, Kedar, Gina, hi Richa, Kinjal, Regina, Dhanlakshmi, Akshit, yes, Preeti, Nandini, Aman, Prithvi, Anupama, SRK. So I should call you Shahrukh. Okay, SRK, Farheen. Hi Farheen. Sonal. Hi Sonal. Pradeep. Yes, Neetu. Hi. Very good evening. Yes, you can drop a mail for the Google Group link, right? Yeah. So we'll start off with the first question. Which of the following statement is true with reference to Glasgow Coma scale? Which of the following statement is true with reference to Glasgow Coma scale? The first option, in the first 24 hours, following a head injury, an overall score of 11 indicates good prognosis. Second option, an overall score of less than 9 indicates poor prognosis. Option C, gives an accurate impression of neurological status. Option D, cannot be assessed in an unconscious patient. So which of the following statement is true with reference to Glasgow Coma Scale? Yes, Akshat, I'm very glad that you reminded me of the vertical slog. I'm very happy that you still remember the question which we haven't answered yesterday. You can refer our e-classes website, right? You can refer oral radiology section, and we have we have posted one video there with the title parallax technique, right? So we have discussed in detail. I've shot that video just before 1 hour. So you can refer that for more information, right? Where we have discussed in detail about the horizontal shift as well as the vertical shift, how we can use them to interpret the position of an object, either buccal or palatal, right? Yeah. Yes. Yes, Namrata, you can go through the Google group link, right? You can download the PDF, you can go through the questions. So which among the following statement is true with reference to Glasgow Coma Scale? And we have answers. So few of you say B, C, okay. So which one is the answer? B or C? Remember, Glasgow Coma Scale will give you a clear impression of neurological status, but not accurate impression. Glasgow Coma Scale cannot be used to interpret the neurological status accurately. And you know what? In order to examine the neurological status accurately, we need to have a look at the following parameters like photophobia, neck stiffness, Kenning sign, GCS, mental state examination, observation of various cranial nerves, observation of limbs, observation of power, tone, reflexes, sensation, coordination, balance, and gait. So in detail, neurological examination has to be done to accurately assess the status neurologically. So GCS is one of the components of these neurological set of examinations, and it only gives you clear impression but not accurate impression, right? So even C is false. An overall score, see, a Glasgow Coma Scale we have discussed in detail in one of the previous videos in e-classes. The minimum score of Glasgow Coma Scale is, what is the minimum score for GCS? Very good, it is 3. And what would be the maximum score? Wonderful. Maximum score would be 15, isn't it? 6 plus 5 plus 4, right? So a score of 8 or less than 8 indicates that the patient is unconscious. Comatized patients, for example. So score of less than 9 indicates poor prognosis. Just make a note of it. Or you have that in your option B. So a overall score of less than 9 indicates poor prognosis. The minimum score is 3, maximum score is 15, right? And score after 24 hours of head injury that indicates a need for proper and continued observation of neurological status. That is 11. So 11 indicates not good prognosis, but it indicates that you should continually observe and follow up the patient, right? So option B is the right statement. I hope it's clear. If you have any queries, you can clarify. You can get them clarified now itself. The components of GCS we have already discussed, right? You can refer the previous video in classes or even in YouTube for more information. Yes, option 1, it doesn't indicate good prognosis. In fact, a score of 11 indicates that a patient with head injury needs proper and continued observation of neurological status. So the patient is under observation. It doesn't mean it's of good prognosis, a score of 11, right? And one more question related to this. GCS, Glasgow Coma Scale, Can it be assessed in unconscious patients? Yes, Namrata, Abhishek, Kedar, good. So Glasgow coma scale can also be assessed not only in conscious patients but also unconscious patients, right? I hope it's clear. Right? So I'm not putting anything on board. I hope you can follow, right? You want me to put on board, I can do that. Farheen, you should tell me the minimum score. We have one video on that. I hope you have gone through that. You just count the numbers. You tell me what should be the minimum score. Exactly. Okay, Farheen, if you say 5, I ask you to refer to the video once again. Okay? Right. So I hope it's clear. Now let's move on to the next question. The popular SAGM blend. So before that, let me just add at this point also. Glasgow coma scale only gives a clear impression of neurological status, but not accurate impression. So the minimum score is 3, maximum score is 15, and a score of less than 9. Unconscious patients usually indicates poor prognosis. Right? Now, the second one, the second patient is the popular SAG M blend is used in which of the following cases? Hemophilia, anemia, burns, disseminated intravascular coagulation, DIC. So in which conditions do you use SAGM blend? So what does SAG stand for? I'll not mention it unless and until you give me the answer. Yes, M for mannitol, good. What does SAG stand for? If S is sugar, G is glucose, both are the same, right? Saline, adenine, glucose, mannitol. So it's nothing but blood from which the entire plasma is removed and mannitol is being added in order to have that osmotic effect. And since most all the plasma is removed, you don't find clotting factors there, no proteins, nothing. So it can't be used in patients with hemophilia or DIC or burns where there is loss of proteins, right? So this SAG media is mannitol is mainly used for carrying your RBC. It's used in cases of anemia. As you most of you rightly said, it is anemia. Farheen says standard addictive solution. Come on, we shouldn't Google everything. Farheen. It's okay, Namrata, that's fine. We all make blunders. No issue in that. The thing is whether we're learning or not in the process. So SAG is saline, adenine, glucose, mannitol, where plasma is removed and mannitol is added for osmotic effects, right? And then, so since it's devoid of proteins, clotting factors, etc., it cannot be used in other cases like hemophilia, burns, or DIC. So option B is the right answer. Yes. Now, yes, hi Purvel, a very good evening. So now I can say good evening to you, right? Yeah, third question. Of the following, a major component of atherosclerotic plaque is smooth muscle, red blood cells, platelets, fibroblasts. So, which is a major component of atherosclerotic plaque? So, we have options: smooth muscle, red blood cell, platelets, and fibroblasts. Yes, the moment we hear of this term atherosclerosis or atherosclerotic plaque, platelets come into our mind, isn't it? Or fibroblasts. Okay, we have almost all the options. Right? So atherosclerotic plaque chiefly contains smooth muscle cells and also to some extent lipids, cholesterol, and platelets as such. They are not part of atherosclerotic plaque. They can get adhered to the surface of this plaque, but they are not the intrinsic components of this atherosclerotic plaque, right? So smooth muscle cells, lipids, cholesterol are the major constituents of an atherosclerotic plaque. Platelets can get deposited on the plaque, but they themselves are not part of atherosclerotic plaque, right? So option A, smooth muscle cell, is the right answer. Smooth muscle. Fine, let's move on to the fourth question. Yeah, fourth. Yes, Kedar, you say it's fat. Okay, if you have the reference, please send us the reference, right? We'll go through it. A patient with, fourth question, a patient with anaphylactic shock should be administered first epinephrine, antihistamines, corticosteroids, oxygen. Okay, good. So most of you say epinephrine. What should be the concentration of epinephrine? What should be the concentration of epinephrine? One is to one, 1:10, 1:100, 1:1000, 1:10,000, 1 lakh, 2 lakh. Good. 1:1000 is 0.5 ml. Good wrinkle, Sardana. Okay. 1:1000, either subcutaneous, intramuscular, or even intracardiac, isn't it? In case of emergencies. So it is epinephrine, which is good. You answered it right. But I want you to tell me the sequence. For example, you're performing a dental procedure. You're given a LA with adrenaline, epinephrine. That's fine. But before that, let's assume that because of some agent in your local anesthesia, patient started having this anaphylaxis, right? So in such a case, what is the protocol you follow? What is the first thing you do and the last thing you do? Give me the sequence. You're doing a dental procedure. You started with the dental procedure. Before starting the dental procedure, you're given some LA. Due to some allergen in LA, patient started exhibiting this anaphylaxis. Yes, even intracardiac can be given, subcutaneous, intramuscular, intracardiac, right? So what would be the sequence of managing a patient with anaphylaxis? You directly go for ABC, Dr. PA, In fact, the protocol is changed as we discussed previously. It is circulation, resuscitation first. So you want to give LA, you want to give Evil. Evil is something which is given intraorally, right? It would take a lot of time to act. In fact, I had taken Evil previously because I had some urticaria. Good, Madhuvita, you stop the procedure, right? So the first thing what we do is, so obviously as expected, terminate the procedure. Good. So what is the next thing you do after terminating the procedure? No, first corticosteroids are not given first. Anyway, steroids, antihistamines can be given at a later time, but epinephrine is a drug of choice first. So after terminating the procedure, what is the next thing we do? Positioning of patient. Right? Positioning of patient. So we have this Trendelenburg position, supine with legs elevated, 15 to 20 degrees, fine. You want to give LA first? Before that we have this protocol. So after positioning the patient, as you rightly said, basic life support, BLS. Good. After basic life support, you call for medical assistance, emergency 108, anything. Then, now you start administering epinephrine if needed. So administer epinephrine. As one of you said previously, now you have to administer oxygen. Finally, the definitive care, monitoring vital signs. Okay, you can even refer dental emergencies by Malamed for the sequence, right? So first we'll start with terminating the procedure, positioning of patient, basic life support, medical assistance, administering epinephrine, administering oxygen, and monitoring vital signs. So what all come under vital signs? So what all fall under vital signs? Yes, Lavanya, you can refresh the video and also try setting it in HD quality or a 720p, right? Yeah, so obviously you have pulse, blood pressure, temperature, respiratory rate, right? I hope you know all the basic values. That's fine. So a patient with anaphylaxis should be administered first. So obviously epinephrine. So it's nothing but an emergency procedure, right? Yeah. So fifth question, the final text-based question, and then we have another 5 image-based questions. A 5-year-old patient is scheduled for tonsillectomy. Fifth question. On the day of surgery, patient had running nose, temperature 37 degrees centigrade, dry cough. Which of the following should be most appropriate decision for surgery? Surgery should be cancelled. We can proceed for surgery if chest is clear and there is no history of asthma. Should get an X-ray of chest before proceeding for surgery. Cancel surgery for 3 weeks and patient is placed on antibiotics. So which one would be the most appropriate answer? Spriti, Namrata, Kinjal, Farheen, Sonal, Shivanshini, Dr. B. Abhishek, Priti, Prithvi, Akshit, Madhumita, Purve, Regina. Fantastic. Namrata, Neetu, Sam Singh. So you all seem to be right on target, right? So bingo. So we cancel the procedure, postpone it after 3 weeks, right? We place the patient on antibiotics. So various contraindications for tonsillectomy includes one of these is having an acute phase of infection. So acute phase of infection, we cancel the procedure, your LA will not be effective. The chances of healing is also poor comparatively in cases of infection, right? So various contraindications to tonsillectomy include presence of acute infection, children under 3 years of age, bleeding disorders, uncontrolled systemic diseases like cardiomyopathies, or it can be diabetes mellitus, physiological disorders, and also at times of epidemics of polio, right? So some of the contraindications for tonsillectomy, right? Yeah, acute phase infections, children under 3 years of age, cleft palate, bleeding disorders, uncontrolled systemic disease, or epidemics of polio, or acute phases of infection as we have discussed now, right? So option D is the right answer. I hope you can make out what I'm saying, right? You can just make a note of it, or you can just go through this video again later time before exam for revision's sake. So we're done with text-based questions. Now we have 5 image-based questions. Let's see how well you're going to do, right? Identify the specimen, and you have a beautiful diagram. I haven't given you any options intentionally, right? I want you to just tell it as accurately as possible without any guesswork. So you don't have any options. So those who are not having the soft copy, I'll share the image. I mean, I can show you the image here. I hope you can see. It's not clear in PPT. It's surprising. It's not PPT, by the way. It's PDF. That specimen is nothing but tuberculous lymphadenitis. So as you can see, we have these lymph nodes, matting of lymph nodes, matted lymph nodes, caseous material. So this represents tuberculous lymphadenitis, right? So a specimen of lymph nodes which are matted. Cut surface shows caseation. So matting of lymph nodes is characteristic feature of tubercular lymphadenitis, isn't it? You're unable to make out the organ. Fine. You thought it's brain? Okay, it's caseous necrosis, right? Those are lymph nodes. I wanted to give you a hint actually, but I felt like, okay, let me just drop the specimen. Let's see how many of you are going to answer. You've done well. Anyways, don't worry, you're going to have more easy answers, easy questions comparatively, right? You'll be given definitely some kind of hint. Like a patient is suffering from tuberculosis, lymph nodes exhibit the following cut surface appearance. So identify what this is. So you can have that kind of question, fine? Yeah. So it is a case of tuberculous lymphadenitis. So you all thought it's brain? Okay, it seems to be like brain, but it's not brain. They are lymph nodes. So 7th question. So identify the instrument. So this one. So identify this instrument. I hope you can see. Okay, good. So don't say scissors, right? So artery forceps, hemostat, straight artery forceps. Good. Fantastic. Mosquito forceps? Yes, Manasi says it's mosquito forceps. Regina says Kelly, K, the artery, Madhumika, good. Fantastic. So, as you can see, you have a ratchet. So, ratchet is something where you secure your instrument. So, this is your ratchet and you have your two arms, right? So, you have a ratchet and two blades with uniform serrations. It's used for controlling bleeding. So, it's nothing but none other than hemostat. Hemostat, artery forceps, also called as Spencer-Wells artery forceps. Okay. So artery forceps, hemostat, Spencer-Wells artery forceps used for controlling bleeding. It has a ratchet and two blades. Mosquito forceps is nothing but curved artery forceps which is smaller in overall dimensions. That's a mosquito forceps. Needle holder, that's a good question, Prashanti. In fact, artery forceps, as you can see in the image here, we have parallel serrations, right? Whereas needle holder will have crisscross striations. You can refer a previous image-based video for more information. I discussed this previously also. So, artery forceps, parallel serrations, needle holder, crisscross striations for better grip. Okay? It's not sharp, it appears to be sharp, but it's pointed, right? Because in order to hold finer blood vessels like venules, arteries, or not even arteries, but arterioles, even arteries, right? You need to have a smaller dimension. So we have various sizes in this, right? So glad that you identified it. Fantastic. Eighth question. So identify the instrument again. No options, Mega. Yes, yes, I'll show you the instrument. So identify this instrument. Good. Dermatome, very good. Skin grafting. Skin grafting knife, also called as Humvee's knife. Good. Humvee's knife. So it has a handle and a long sheath. It's used for taking skin graft, also called as skin grafting knife. It's not some kind of air pressure, okay? Right. Yeah, final questions. Skin grafting, Prithvi. 9th and 10th. So identify the tooth. I've given you occlusal surfaces of two teeth. So identify them. Ninth one is the top one, 10th one, the bottom one, right? Fine. Premolar, wow. Maxillary first molar. So most of you are sticking to first, second, third. Mandibular? No, no chance. See, obviously you have two buccal and two palatal cusps, right? The ninth one resembles more as if it is a maxillary second molar, right? And the 10th one, obviously it is maxillary third molar, isn't it? Yes. However, both these belong to the occlusal surfaces of your maxillary third molar. So both are maxillary third molars. We have different occlusal morphologies or occlusal patterns, rhomboidal or heart-shaped. The ninth one which I have shown you, it is rhomboidal. So rhomboid is a parallelogram with unequal sides and angles are not right angle. So that's a rhomboid. So the ninth one is a rhomboid shaped occlusal surface of maxillary third molar. Also appears to be like maxillary second molar, right? So you can give it as an answer as well. It depends on the question options, however. The 10th one is maxillary third molar, heart-shaped occlusal morphology. So, right, you have these two variations, rhomboidal outline, heart-shaped of maxillary third molars, right? Yes, you can see oblique ridge as well. In fact, occlusal third molar has numerous morphological variations, right? Doesn't have a specific anatomy. Fine? Fantastic. So it's 36 minutes. We could complete our session today real quick. I hope you got a few valid points, and also we have uploaded around two videos in our e-classes today. The first one is yesterday we have discussed regarding positioning of unerupted permanent canine using a OPG and an IOPA. So slope technique in vertical orientation, we have discussed that in one video. I posted that in oral radiology. And the second video, I have done one video on key terms in dental cements, where I have given you a brief description of few terms and also I have given you a few additional points pertaining to dental cements. We'll be uploading that tonight, so you can refer those two videos today, right? Anyways, you will get a mail updating you regarding the addition of these two new videos for our in our e-classes, right? Mesopalatal distobuccal cusps regina, the largest cusp, mesopalatal and the distobuccal. So the ridge joining, the elevation joining these two cusps is your oblique ridge. So this is what we are talking about. Oblique ridge extending from mesopalatal to distobuccal. By the way, these are your right maxillary third molars. Thank you so much, Abhishek. Sam, thank you, Sam, for giving the mail ID. Sonal, we have one PDF regarding normal serum concentrations in our e-classes. Fine. So I hope your preparation is going on fine. So I often hear students telling me that they're having more and more fear. So let me just tell you, I know we all face fear. We all have this propensity to face fear or have fear before exam. Consider this absolutely normal, but don't let that fear bow you down or move you down, right? So just hold on, just focus on practicing what you have been doing. So I've been mailing you all, I've been getting good replies. You have been doing your best. So you are doing your best within the available time. Just carry on with what you're doing. That itself is more than sufficient. You need not do something which is additional or extra now. As I said, you need not sacrifice your sleep or good food, right? So in fact, you should have good food and you should have plenty of sleep so that on the day of exam, you're definitely going to have your presence of mind, because I often hear students telling me that we fear for the fact that we might not use or something might not strike at the time of exam. So to avoid such problems, you need to stay at peace. So if you feel stressful, if you feel that you're not really confident in doing, so obviously that will get reciprocated there. So the point which I'm trying to say is stay cool if possible, or else don't let the stress break you down. Just hold on. You're definitely going to do good. Those who feel stressed up, those who are afraid of, those who have this anxiety or panic attacks, definitely you're not going to have all that in your memory on the day of exam. You're going to suffer a lot. So try maximum to control your feelings. Just hold on. Only thing you can do is hold on. Hold on in the sense, if you are not able to control your thinking, focus on work. So obviously when you start focusing on work, when you start focusing on practicing, when you start focusing on studying, noting down, attending live sessions, using your brain, you will not have time for other negative things like panic attacks, fear, anxiety, right? So focus on what you're doing the best, do the best, whatever you can in the available time, and I'm sure you're going to rock the exam, right? Trust me, those who stay fearless and those who exude confidence are definitely going to have an edge over others on the final day of exam. Believe me in this, right? So Abhishek, you're having fear of not having fear. Fear in any sense is dangerous, Abhishek. Yes, Sonal, we have that in our e-classes. E-classes is for our registered students. Fantastic, Abhishek. I just liked your comment. So you have fear because you're not really afraid of things that are happening right now. It's good. I'm having fear of not having fear. Okay, Dr. B, thank you so much for your love and affection. Yes. Okay, right. So we'll see you again tomorrow with key points. Hope you enjoyed this session and I wish you all the best. So keep that particular thing in mind. Those who stay fearless and those who exude confidence are definitely going to have an edge over others in the final day of exam because your mind works well. You'll definitely remember what you studied for, right? So believe me, that's going to happen. So try to stay fearless. At the same time, exude confidence, believe in yourself. Just focus on what you're doing now so that you'll not have time for negative thoughts. Fine? All the best. Love you. Take care. See you tomorrow at 8 p.m. again. Bye. Yeah, great to hear that, Matt. Good night. Bye.